collaboration with what they call RENU, it's a Research and Education Network, to provide linkages and bandwidth to the different universities. We are extending to several. We have done STEMA, we have done a few others, Jambogo and the like. So we are extending to several others. Number two, what have we done? Bring down bandwidth. We have had negotiations with the CCOM, those organizations which provide bandwidth from internet, from the sea. Some of them have already come here and have landed in Kampala. They are using the national backbone infrastructure to bring that cheap bandwidth here. So soon you will see what? The prices going down. We are providing the internet bandwidth to government institutions, and maybe I can wind up on the other questions. Specifically, what kind of research activities are you carrying out to influence policy? We actually do studies and research and surveys to be able to inform policy. One of these areas of the recent ban, some time back there was a ban on importation of used computers. But that ban was instituted without any empirical research to see what the effects would be and look at all the other areas that would be affected. We were asked by Minister of Finance and Cabinet to research and be able to find out whether they should lift the ban or not. The research has been completed and we consulted very many stakeholders, and indeed what got the lift
of my interest, because I saw that this partnership, this platform is aimed at this meeting, but also this platform is aimed at influencing policy. So I do realize that my research has potential to contribute to education policy change. So I'll talk about the introduction, what I'm already giving. I'll give a few highlights about what my study is about, and I believe that this should culminate into sharing of my variables and what the would-be implications of this study could be. So, education, what is it? And it is very pleasant to talk after my supervisor has spoken, because he's a seasoned educationist. Education can be looked at in very many different ways. Many of us in modern times forget that education is even, after all, a human right. That you cannot talk about no education. There is no situation where you can not talk about any education at all. But at the advent of formal education, as we well know, our mindset seems to have shifted, and there have been implications for this country. So that need of bullet education is formal or informal. I'd like to look at my way, so how do I nest my research? That community-based education is another way to look at education. Education beyond the classroom. Education as dialogue. And education is a key factor in the sustainability of healthcare practice. So here I'll talk about whose education matters, education for what purposes, so that we start to think about value for money of what we do. And my problem that is at the core of my research is that there is disparity in both education, processes, outputs, outcomes, but also in healthcare. I think when you start talking about the HIV/AIDS study that I already talked about, the issues are glaring. We almost would like to believe the former president of South Africa that actually some diseases are diseases of poverty. So, for Uganda, healthcare within remote areas of Uganda is in a difficult state, with the rural populations having an unfairer share of poorer health indicators and outcomes. This is at the gist of my problem. Those ones are talked about. Move on. Continue. Those ones are talked about. So, now my friends, especially those who would like to pursue a PhD study in the social sciences, we have to theorize how do this problem that we are investigating, how do other scholars before us, how do scholars today look at it? And there is the public choice theory presents the business of engagement between policy actors and between policy implementers and the beneficiaries as a situation of mistrust. So then that can create a tug-of-war situation. And on another hand, the elites look at those who have not gone through the formal education system as the other, as those with less knowledge, as those who know less. And when such a situation prevails, education can only help to disadvantage the already disadvantaged. On another hand, Paul Freire's theory presents education as a dialogue process. And that theory of Paul Freire, where education is dialogue, the transaction of the business to make things better, in my case in terms of healthcare, is the theory that I base on my research. I've talked about the context of healthcare. I've already given examples about HIV/AIDS. The colleague of mine talked about these things. So they are glaring issues. So, how about my variables, study variables? Community-based education. What is it when we are talking about community-based education? As I read about community-based education, I did realize that actually most of the context, it is routine, it is business as usual. Education is tending to be routine, business as usual. Even though the issues of community-based education have been fairly touched on in environments such as in Canada, environments such as in Europe, in Scandinavia particularly, and mostly in Australia, we do see that in the developing countries there is a tendency to copy and paste. This can only make the situation worse. So I did realize that apart from a scholar who studied community-based education frameworks with the University of Jazeera, people are just doing things haphazard, and Dr. Carter talked about it. So one of the burdens that I grappled with was to develop a framework for my research. And I do see that for community-based education to make meaning, it has to be embedded in the curriculum. So there's a community-based education curriculum. And there have to be well-designed students' projects that address a problem, such as equitable healthcare in my case. And there has to be collaborative learning, what I call dialogue. So my purpose of my research is to investigate whether actually this form of education, community-based education, has an effect on equitable healthcare delivery. And I'd like to use the case of my University of Science and Technology because, again, out of desire and ambitions of the leadership, a university that was regarded to be community-based was started, but without empirical basis. Myself, the researcher, hypothesizes that community-based education will have a positive effect on equitable healthcare delivery.
Now, the main objection to this bill is that although it is worded widely, national biotechnology and biosafety, when you read it, it's simply focusing on genetically modified organisms. And I understand it is being pushed. You may have heard of the company called Monsanto. It's being pushed by those people. So there is a lot of concern about what will happen to our local agriculturists. The other point was about the coursework and I think dissertation, doctorates. I think at Makerere we have also started doctorates where you do coursework and then you follow it up with a dissertation. Of course, people are always confused. Whenever you do coursework followed by research, you submit a dissertation. But if there is no coursework, then it is a thesis. And finally, I think getting back again to the biotechnology, we should note what is in the Industrial Property Act. It is the new act, Section 8, I think subsection 3, which has modified the law in such a way as, I think, to allow what the National Biotechnology and Biosafety Act is trying to introduce here. Previously, that would not have been possible, but the law has now been modified to allow for it. Thank you very much.
I took it that for you, what you do is operational research. It is demanded because you want to guide a given policy. But what about us doctoral academicians, doctoral scholars? What can we do? We write, we put in the journals, we write, we put in the policy briefs, and more to that, we are not an advocacy organization. So we are stuck. We don't know how to increase our research uptake.
Dr. Mugwanya. First about the ARV and HIV prevalence. I want to hear your thoughts. Whether we are not in an ethical dilemma on this matter. Because we are talking about prevalence, the prevalence of HIV has gone up, and we are beginning to see the incidence rise. But colleagues, we know that one thing that influences prevalence is the advent of treatment that does not cure a problem. So when you put a patient on a treatment that does not cure the problem, he's going to live longer. So prevalence will automatically go up. So is it the increase in our national prevalence simply a response to the success of ARV? And then number two, now that you're keeping infected people longer, also we should be seeing a rise in the incidence. So, and we're seeing that these figures, these epidemiologic figures we're using, simply a response to the introduction of ARVs more than a new threat that actually our original interventions are failing. It's a very, what I think is an ethical publication in the new vision that that gave the distribution of HIV by tribe. Very, it might be very unethical. That leads to the stigmatization of people by tribe. And in all the books, I haven't found tribe to be a risk factor. Risk factor. Risk factors in public health are those factors you tend to change to be able to address a problem. I wonder what your comment about that is, and how, with all the brain power that's working on HIV, and with AIDS control programs, with HIV control commissions in this country, that a national paper could be allowed to punish, punish tribes by demonizing them like that.
It does make ground. It's true, when people live longer, then there's a higher chance of potential entrance. Because early on, when you have just gotten the HIV and your viral load is quite high, the amount of virus in your body is quite high. But then the body tries to fight it, and the amount of virus goes down. So at some point you don't transmit as and then you transmit later when you are sick. However, for the treatment, the biggest determinant which decides whether someone actually transmit is the virus. In those people who are HIV infected, there is actually a higher chance of them not transmitting other people in the population. And actually, that is the one which the current study which looked at HIV responders goes to the chance of reaching 96%. So that's the whole one. There is, yes, the risk of transmission. That's
Thank you.
So, I have listened very carefully to the distinguished remarks from all of you. I appreciate the concerns that you have about influencing policy. I'm not sure that I can give strong advice on how to do this. My own experience is extremely varied from the time I was teaching, both in the United States and here at Kennedy. In the United States, I did have some opportunities to do research for the government, federal government, but that research depended on my superiors, my deans and so on, having contacts in government and being able to influence their contacts in government to give us money to do research. I did some work, for example, on sources of mining equipment in the Congo, what was called the Congo those days. And this was back in 1977. I did some work when I was teaching in Maryland. Again, the funds being obtained from the federal government were based on the contacts that the people I was working with had in government. So my first point then is that it's clearly important to cultivate contacts in government, and this can be done both on an individual basis, but perhaps more strongly on an organized basis. Now that you have an organization, DNU, I think that you have to strengthen this organization's work and to demonstrate that it is capable of doing certain things. Now I notice that you have diverse expertise in health, epidemiology, education, computing, IT, and so on. So I do not know how credible you are likely to be with such diverse expertise. I think something that would have, on one hand, it can be a strength in that you can take advantage of many opportunities when they come by using individuals in the organization who happen to meet a particular need in government or in society. That could be one strength. The other is that if you have so many diverse people in expertise, do they have the depth to create credibility that you can actually outdo, outcompete other would-be applicants? That's something that I think you have to think about. So if you came to me and you said you want to do something in a particular area, I would be looking to see whether you have sufficient depth, sufficient expertise, sufficient manpower to actually do it. And of course, the assumption is that there is a secretariat which can assist you to put together the necessary applications and write-ups that are required either to compete or to put forward convincing proposals to government. But I think that this is something that you have to discuss as an organization, whether you want to cover so many areas, or whether perhaps there are some fewer areas in which you want to develop a great deal of depth, because it's all about credibility. You come to me as a policy maker and you say you can do something, I would want to know, have you had an experience? How much experience have you had? Are you credible? Whom can I ask about you? Who tell me what you can do? That's an open question. Now, I'm raising that from an academic standpoint that many of you seem to be in academia, and you want to be relevant, you want to be listened to. It's extremely difficult. The people in government that I know, as indeed Mr. Carter pointed out, they are very busy. They think they know what they are doing, and it's not easy to persuade them that you in academia know anything, because you are considered to be academic, meaning you only know things on paper, but you don't know what goes on in the world. And so, for you to be able to say that indeed you do know what you're doing and you can be helpful, it's not easy. It can be quite a lot of work to persuade people that you do know what you're doing. Now, when I was in the Ministry of Finance, I had an advisor from the EPRC, Economic Policy Research Center, Dr. Mumza, who had been there for some years. And based on his work, we thought that he would be a good advisor, and he was. I was happy to have him, and I felt confident in many cases, traveling with him and having him around and trusting him to draft positions and papers that were presentable and acceptable. In the central bank, we had, I believe, Dr. Simzi, he also had a PhD in monetary economics. And when we go to Washington and had these people around us in IMF and so on, we feel confident that they knew what they were doing. But they had been, Dr. Simzi had been in the central bank for a long time. He had been with me when I was in the Department of Research. And as I said, Dr. Mumza came from EPRC. So here, it's a question of, sorry about this, there's an issue of positioning yourself nationally and being known as an expert in a particular area. And then there's also, of course, also an element of luck. You can't predict who will be called upon for expertise or not. But let me mention this point about influence. Naturally, we all like to be listened to. We like to feel that we are influencing policy in a direct way. But in a larger sense, we are all members of our society, of our country, and there is so-called market of ideas. You have your classrooms, you have your fellow academicians, whom you are in communication with. The student body, when I was teaching in Makerere, I think my class was between 300 and 400 students from all over Africa. That's a lot of influence. Those people go and influence others. I don't think it's proper to underestimate that influence. Many of this morning I was addressing the Director of Economic Affairs in the Ministry of Finance. They're having a retreat in Uganda. And some of them were my students. They are now in charge. And so certainly I had some influence on them a long time ago. So the point I'm making is that let's also have some measure of humility in what we are doing, and also a measure of appreciation of influence that may not be in the headlines of the newspapers, but which nevertheless is real. If I go and address 20, 30, 40 people, as I do quite often, it may not be in the newspapers, but it has impacted individual human beings in different ways. And that in itself is not nothing. Because at the end of the day, what really matters, we are all seeking to improve the condition of human beings in our country and beyond. In whatever way, in all walks of life, in wherever we have the expertise. Government is seeking to do the same. The purpose of policy is also to do the same. And government collects only 14% of total income, and 86% is from private sector. So 86% of the impact on the livelihood of human beings in this country is private sector.
Policy decisions, in many instances, are made based on people's feelings, other than based on facts. For example, if somebody felt that his position in the government is being threatened, he quickly initiates a policy with no scientific study as to how that policy is going to emerge and be implemented. The second fundamental problem we face is that people who formulate policies and discuss policies have no capacity to do so. I always say when I meet my colleagues in politics that if I look at the Ugandan regulations, the law that regulates who's supposed to be elected to go to parliament, the minimum standard is A6. Also, this is the A-level possible dropout. He becomes an MP to go and discuss very complicated economical issues on the economy of the country. By the way, he even defended farmers at O level, and never even did economics at A level, but he's discussing the economic directions of this country and his decision matters that affects this country. Now, if you look at the regulations that govern us, especially in terms of who participates in making the policy, one important thing comes out. What capacity will those
public policy management, NGO management, development and evaluation. So we are really discussing her area of specialty. She teaches project planning and management. Ladies and gentlemen, after she's spoken, we'll have some refreshments and then a word from our Secretary General, very briefly. So please stay. We shall also have a photograph, I think, to take record of the fact that we are here. Thank you.
Thank you very much, Chairperson. Ladies and gentlemen, join me to give a round of applause to our speaker, Dr. Suruma, this afternoon. Doctor, we are very grateful. What I've learned from you is that we all have a contribution to make. In whatever, in fact, you challenged me. I've been in front of students every day almost of my life for the last 15 years. And the students are policy makers. Just as Dr. Nkata was saying, we teach permanent secretaries, members of parliament, name it. But we never get to think that we are influencing them. We know that they are here to learn, get skills, and go and do better. But we also wanted to appear in newspapers and on television to know that we are better influencers at that level. But I have now taken it that wherever I am, I can make a contribution. Members of the Doctor Network, I'm very grateful that you chose UMI to host you this afternoon. We've discussed a number of issues, and I'm glad that we can all come together, the old, the young, the ladies, the gentlemen, to think about